So Anna Ricklin is in an actual, no kidding, real public health department as manager of health and all policies. We're eager to hear you.
Great, thanks. I didn't prepare any slides. So, but first I I have a 9-month-old baby, and sometimes she goes, yay! So I want everyone to go, yay! Victory! And then sometimes she goes like this. And I call that super baby. So just to wake up a little bit in our last talk. So yes, I am in a new role with the Fairfax County Health Department called Health and All Policies Manager. And actually, technically, it's an urban planner / Health and All Policies Manager. So I have a public health training, but also urban planning and transportation in my background. I had the honor of working at the American Planning Association prior to being with Fairfax County Health Department, and now excited to bring some of that work that I did at the national level and things that I learned to a local community and have more of a direct impact on folks living at the local level. I even moved to Virginia, so. It's really neat to be there. And I'm part of an office called the Office of Innovation that was created by the director, Dr. Gloria Adoayensu, in case anybody knows her. She's been the director of the health department for quite a while in Fairfax. And the Office of Innovation was in reflection of one of the remarks this morning that the CDC and other kind of national benchmarking organizations say it's now public health 3.0. Now it's a culture of health. Now it's whatever. And there's a lack of tools to really operationalize what that looks like at the local level in the health department. And so what Dr. Gloria has done is actually reorganize the health department to some degree and created this Office of Innovation to be more of a nimble group of individuals to address the public health 3.0, which is the direction that we're really moving now in Fairfax. And so it's me, a person who's a workforce strategist who couldn't be here because she's at her daughter's wedding, and a research analyst to work on special projects as they come up. So one of the special projects that person just completed last year was a whole initiative around the opioid crisis and creating a plan for how Fairfax is going to address that. That project was put together. It was given to the county exec. They've hired an opioid director who's in the office of the county executive, and that person has moved on to work on a new special project. So just to give you a sense of how that office is organized from a workforce perspective, as well as having a workforce strategist in that office to actually address workforce capacity in the organization to start to address some of those things that we know are true, that we want to retain our people, that we want to give them new opportunities to grow within the organization in the health department, and maybe also recognize that they might have a next step up at another agency within Fairfax County and then come back to the health department with that new knowledge and breadth of a little bit of cross-sector training and experience to continue to grow the capacity within the health department. So it's a flexible framework of thinking about expanding our capacity across the whole organization of Fairfax County, which is part of where my role comes in as an ambassador for public health to agencies across the county who we think of as being public health actors, but don't necessarily think of themselves as public health actors. So I have built my 1-year anniversary with the county is this week. So in this short year, I've been able to build bridges with folks in the Department of Planning and Zoning, with folks in transportation, starting to get to know people in housing, starting to get to know people in, we have a neighborhood and community services department. All of these folks are sometimes in the same room when like a big project is happening or some other kind of initiative is going on, but they're not often building relationships that are ongoing, and they're certainly not usually building relationships with the health department. So having someone in the health department embedded with other agencies has been really key to helping advance that cross-sector conversation and bring health into the conversation where it wasn't before. So, my position didn't arise out of nowhere. There was a foundation before I came on board to identify the position and get buy-in from other agencies to having me even join, or having my role even join the county. Interestingly, my second interview was actually composed of not just the health director, but the director of transportation, the director of urban planning, the director of land development services. I didn't know that going into the interview. That was a little bit like, okay. But they all, Dr. Gloria really wanted those people, those heads, agency heads, to have buy-in on who the person was that they hired, so that they could then ensure that when I am working with with my peers, in middle management at their organization, that those folks that I have the support of their director, which has been very helpful. I've been able to say, oh, I was talking to, Tom, the DOT director, about la la la, and the staffer says, oh, okay, well, if Tom says I can do it, or says that we're working on this, then I'll say yes, and I'll give you the information, or whatever's happening. So building bridges, and then also going into those other agencies and sitting in meetings where, historically there wasn't any health representation, and what my director calls gathering intelligence and finding out what's happening. What are the big things that are happening? What agency is developing a new strategic plan for the next 10 or 15 years? What's a new development project that's happening where the health department should be at the table to do either a mini health impact assessment or maybe a larger scale health impact assessment? I did one of those recently in more of a desktop health impact assessment model of a large hospital development happening on the Beltway in Fairfax County, where there's a concern about, community safety from the increased traffic, and other community benefits that may or may not occur as a result of this giant development. So looking at those factors with more of a health equity, social determinants of health lens. Clearly, if a hospital is developing, we have great access to health care, but what about the other factors in the community? So that's a little bit of an overview of, one other thing about the creation of my position, again, from like the more workforce angle, is we had buy-in from the other agencies, but then when it came back to our own HR in the health department, HR said, well, we don't hire planners. You can't hire a planner in the health department. That doesn't exist. And so they had to really, the management who were working on this position really had to work with HR to help them understand that we can hire a planner in the health department, that it's not just, so it's not just like the political or the director support that's needed. It's also, when we're really talking about systems changes, we have to look inward as well as looking outward and trying to change the system on the outside. So I thought that was interesting when I learned that fact recently. And then I also, they purposely embedded me in the building where the land development agencies sit. So I actually have an office 3 miles away from the health department's building, with the Department of Planning and Zoning and Land Development Services. So I get to have those casual hallway conversations. I can just go upstairs to the meetings. It's a lot more accessible to be part of those conversations. So it's really, I think it's a dream job for me, and it's there's only a handful of us in the country who are health and all policies people officially, and not just doing it as side work and trying to do it on top of your other day job and all of that. But I think it really represents a new approach to partnership and policy making, having that role. So another thing I was asked to talk about was other cross-sector training that occurs throughout in the county. So a few years ago, there was an initiative called Fairfax First to streamline land development, work better with developers to move projects through more quickly, et cetera. As a part of that, they developed a 6-week course called the Joint Training Academy. And anybody in the county can take this course, and it's all about the land development process, starting from the comprehensive plan, moving through zoning, into all of the permitting and the complexity that goes into building something new. And we heard from stakeholders, including developers. The health department's a stakeholder. So that was a really interesting 6-week training. It was 6 weeks to go through, not every day, but it just shows the level of investment that the county is willing to give to help people understand what the land development process is. There's an ongoing Lunch and Learn series that's really exciting. A few years ago, the health department hosted a Healthy Community Design Summit with stakeholders from across the county, including the deputy county executive for the land development agencies, other leaders from the land development agencies, and by that, transportation, planning, and zoning. And also planning commissioners came, so community leaders also were part of that. And then speaking a little bit to back into the public health world, the county sponsors a Master of Public Administration for county employees at George Mason University. They pay for you to do an MPA. You have to apply through the county. You have to have your supervisor support it, et cetera. It's a night program, so you have to have the time. But they really are supporting advancement for staff to get a Master's of Public Administration. Just this month, the health department also finalized a new program for our public health employees who do not have an MPH or a higher level degree to get a public health certificate paid for by the county with George Mason University, and it's half of the number of credits towards an MPH. So the hope is that if people have at least half of the credits, they'll get the certificate, which is great. And if they have the resources and the time, they'll continue on and complete an MPH. And there's interest across Northern Virginia in from the other health departments in participating in this. So we're having our first pilot this fall of people getting a public health certificate, and then hopefully next year, Alexandria, Arlington, Loudoun counties in the Northern Virginia area will hop on board and help grow that effort to really grow the capacity and the workforce in the health department. So there's a lot happening in Fairfax when it comes to workforce, and I'd be happy to answer questions.